So in my opinion, a patient is never a drama queen per se, or a burden to a provider. Most patients have never had a cancer diagnosis or been through cancer treatment. And you don't know what to expect. You don't know what's normal and what's abnormal. And so my patients, I always encourage them, call me if you have questions, concerns, or something doesn't feel right, because I deal with this every day where a patient might have never gone through this before, hopefully. And so I would just say, if you ever have the thought that you should call your provider or ask your provider this question, the answer is yes, you should. And so never be afraid to reach out to them. As far as the ER question, I would just say, the ER is never the wrong answer. If you are worried about your health, if you're worried about your safety, or you can't get communication from your providers, ER is always a good answer, because that will give you fast, immediate care. And that's what's most important, is to keep you safe throughout this journey. So I would just say, obviously, you get the information that identifies you. And then the next part of this is try and concisely and quickly convey your concern, and don't minimize the severity of what you're feeling. I think we tend to do that all too much, of just saying, I'm just probably blowing this out of proportion. If you're having severe pain, you need to say, I'm having very severe pain and I'm concerned about this. Or if you're having nausea, I'm having nausea that is not controlled by my medications, and I'm concerned about this. So you hear I keep saying the term, I'm concerned, and it's just conveying that severity with it. For us, as providers, we see a lot of stuff every single day, and it's easy to also minimize. And so when a patient comes to me and says, no, this is actually really impactful on my quality of life, that helps me understand how severe those symptoms are, and can be really helpful in how quickly I can respond to something. This goes back to being empowered as a patient. And it breaks my heart a little bit to have a patient feel this way and feeling intimidated, because I think everyone should have a good rapport with your provider, because I think that inspires confidence. And I think sometimes that providers don't realize the way that they come off. And I think if you can approach it in a tactful way and just say, hey, I have a lot of questions, but I feel like but you make me a little bit nervous, and when we talk about things, because I don't want to upset you, or I feel like that you think that I don't know what's going on. But I think when a provider can hear those words of just saying, hey, I need a little bit more kind of compassion or explanation from you. And don't ever be afraid to be that way. As providers, we're just humans. And so, if we came to your work and say that you are a barista, I don't know how to make coffee. And so I'm going to count on you to kind of be the expert in that. But at the same time, we're just people. So just don't ever feel intimidated by somebody. Don't ever feel like you can't ask the questions. And if you're not getting what you need, just say that, just say okay, you're giving me some information, but I need X, Y, and Z to really understand what's going on. And if that provider is not providing that information to you, or is also not making you feel comfortable in your treatment, then it is not inappropriate either to look elsewhere to see if there is another provider that might fit better with your goals of care and what you need to be successful in treatment. So again, it's just advocating for yourself. And if it's a situation that you don't feel works for you, and you've tried to address it, then look outside of that. Even sometimes within the same practice, there might be somebody else that you just jive with a little bit better, that might work better for your treatment and in your cancer journey. this is a very kind of difficult question because as a cancer provider, I know that we tend to hyper focus on cancer treatment, and it's easy to. It's sad that we forget those things are there, but really our priority is to treat the cancer, and then everything else kind of takes a backseat to that. I think a great aspect of this was fertility preservation. And unfortunately, I think many times there's a disservice to younger patients because the speed at which we need to treat is very fast. And so, if there's anything you can do in your hospital settings or in your clinics to encourage them, as soon as somebody has a diagnosis, the next conversation in a young adult should be fertility treatment, fertility preservation. Outside of that, it's just, I always say it's good to have one driver of your healthcare. So in that case, it would probably be your oncologist. But it's never bad to also have like your PCP, your primary care provider, in the wings, and they can kind of be following those other aspects. Really, any care that's delivered needs to kind of funnel through your primary oncologist because there's risk for interactions or side effects. But it's always good. I just say have the conversations and keep having them. And so I encourage you every visit that you go into is to have a list of those important questions of, how are we going to focus on fertility preservation? Is there any other healthcare maintenance activities that I need to be participating in right now? Or are there things that we can also put off for a period of time? But what's the implication of that down the road? And that at least gives you a timeline and a roadmap of how you can, or what to expect as you progress through your treatments and into recovery. But just keep asking those questions, keep communicating those things. And like I said, it's not ever wrong to have your PCP or other providers kind of at standby to help us out.